scored a 269 on step 2. Key for step 1 is
why you chose to go through the USMLE step rather than NEET PG.
Publish as much as possible in medicine. One of the main things you need to do in the USMLE journey is...
Hey everyone, my name is Rohan Shah and I'm the host of The Memoirs. Today I'm joined with a very special guest, Dr. Rishabh. Today we're going to talk about a little bit about the USMLE journey. He's currently a USMLE aspirant who's going to be applying for the match in 2025. I'm going to let him introduce himself a little bit. Why don't you get started?
Hi, so I'm Rishabh. As Dr. Rohan pointed out, I'm a residency applicant applying for the match this September for the 2025 match. I'm a NRI alumni, 2K16 batch. I'll just go ahead and list my credentials down. So I passed my step 1 in October 2022, scored a 269 on step 2 in June, following which I did 6 months of electives at institutions like Cleveland Clinic, Stanford, and University of Florida, Jacksonville. And I'm very excited to be on this podcast. Thank you for having me.
It's great to have you here. So as you guys can see, very credible source here that you guys are having. Honestly, it's an honor to have you here.
Thanks, man.
First, I want to ask you a bit why you chose to go through the USMLE step rather than NEET PG.
So that's a very nice question, and I think there's no simple answer to that. But what I'd say was, when I was rotating through medicine and surgery during my 4th year, I kind of felt this need to experience a different system of healthcare, where I wanted to experience a system where there was more emphasis on research, teaching, and just more emphasis on academic inquisitiveness in general. So that led me to kind of pursue the USMLE path, and then I kind of continued on that journey from there on.
That's awesome. That's a great thing. Now, a little bit like going away from that, more specifically on USMLE, can you kind of give us a little outline about the whole process of USMLE just on a general scale?
Sure. So let me break this down. USMLE as a whole, when you look at it, might seem really complex. But I think the key while approaching USMLE is breaking it down into simple steps, right? So that you don't get overwhelmed. So I take it like this. You initially have 2 steps, step 1 and step 2. Step 1 focuses on your basic science, and it's a pass or fail exam, right? And step 2 focuses on all your final year subjects. That is the clinical subjects, right? And that is a scored exam, right? So these are the 2 main steps if you have to clear the USMLE, that is the medical licensing exam. Following which you have other steps, which we'll get to. But the 3 main things I'd like to list out in the process are electives, research, and volunteering. So both your steps, electives, research, and volunteering, make you kind of prepared to sit for the match. So that's what I'd say the process is in a nutshell.
Okay, yeah, that's excellent. That's just kind of a bit of an outline. Going specifically, for those of you who don't know, a step 2 score at that extent is extremely high. It's difficult to get. That's an amazing accomplishment. So can you kind of guide us a little bit on how you prepared for step 1 and step 2 and what helped you with that?
Right. So here I think it's really important to understand that the Indian system of education at this point of time is not compatible with what you're learning on your USMLEs, right? So there's a lot of emphasis on physiology and pathophysiology on your step 1. And I think it's really important to nail those subjects when you're preparing for step 1. A lot of those concepts get lost when you start preparing later on in internship, because it's been a while since you've studied for these exams, right? So you tend to forget a lot of those concepts. So I think the key for step 1 is zoning into those basic physiological concepts, right? So the way I prepared for step 1 was, I took a total of 6 months, where I spent 4 months doing my first pass of UWorld. So I'll get to what UWorld is in a while, but UWorld is basically this question bank, which is the gold standard for USMLE, right? If you want to get to know how USMLE tests you, I say UWorld is the place for it. You get accustomed to the system, the way USMLE wants you to think, the way you want to answer questions on test day. It's like the perfect resource for USMLE. So the way I did this was, I'd break this down like this. So I did 4 months of Boards and Beyond, which is a video resource, which I'd highly recommend, because in India, I wouldn't say India as in general, but from where I was coming on, my basics were very weak, right? So I had to consolidate my basics. So that's where I kind of did 4 months of Boards and Beyond videos, and then I read first aid. So I'd look at first aid like this. I won't look at it as a resource just for learning, and look at it as a resource for consolidating your existing concepts. So don't try to mug what's in first aid, but try to really understand what's written in first aid. That way you won't forget. And then it's really important, once you kind of solidify your first aid with whatever video resource you want. I use Boards and Beyond, but you also have alternate resources like USMLE RX at this point. So you can take an informed decision based on what your foundation levels are and what's comfortable to you. But definitely do first aid and then apply UWorld to those concepts in first aid, because it's not about reading and memorizing in USMLE as much as it is in NEET, which I'm sure people told you. It's more about applying your existing concepts. So the concepts might be, I don't know, very few compared to NEET, but the way you apply those concepts is really important. So that's what I did for step 1, and I'd like to add, one of the reasons I kind of scored this high on step 2 was because I had a very, very strong base in step 1. I didn't prepare for step 1 like it was a pass or fail exam. And that's what I want to emphasize to you guys. I want to say step 1, you prepare for it like it's a scored exam, because literally 60% of step 2 is step 1. So make sure you zone in on your step 1 basics. That is about step 1, man.
Yeah, that's awesome.
And you basically have a set of exams, which I could probably detail in later, but they're called NBMEs. They're the self-assessment exams that are made by the USMLE people. You have 6 NBMEs, as much as I recall. It was from 26 to 31. So I definitely go over at least 4 of those NBME forms, because a lot of what comes in your actual exam are concepts that are derived from those NBME exams. So definitely go over those once you're done with your first pass of prep. Use your NBMEs for revision. Go over first aid again for consolidating. And I think if your scores are hitting the mark where you want it to be, which for me was around the 240s, I think you're good to go. Good to go and write the exam. But I think I'd emphasize this again. I don't want to be repetitive, but I really want to zone in on your step 1. I mean, do that really well, because that'll help you massively for step 2. And it's insane how many concepts repeat from step 1 to step 2.
Yeah, no, that's awesome. That's some great advice that we can have on step 1, and then how to use that for our step 2. Next, going away from like the testing system, the CV is like a really big part of the USMLE process. So how did you develop that, and what do you think we can do to build our CVs?
Right. So thinking of this whole CV building thing as a whole can be really overwhelming. So let's break it down like this. Let's think of it like electives, volunteering, research, and organizations, right? So let's look at it like this. One of the main things you need to do in the USMLE journey is get really good electives, secure good electives. I think this part is kind of lost in translation. A lot of people end up going through agency electives, third-party electives, and what that does is it doesn't get you someone credible to write you a letter of rec. And think of the USMLE selection process as a job interview, right? They're only going to select you if they know someone credible is vouching for you, correct? So you need to really zone in and find good electives. These are at universities, right? So how do you find these electives is a good question. So we have something called as VSLO, which is a portal where students generally apply for electives. Unfortunately, our college, we come from NRMP Medical College, our college does not have VSLO as of this moment, right? So the opportunities we have are limited, sadly, but we have around 10 colleges we can apply to as non-VSLO students. And it's really important to kind of find out when these colleges are opening their admission forms in, right? So most of them open in March or April, and then you probably got to apply at least 7 to 8 months in advance. So zone in, make sure you get nice electives, diversify your experience so that you can secure good letters of recommendation. So that was the electives part. When it comes to volunteering and research, volunteering is something you should probably think of in 2 aspects, right? One is medical volunteering and one is non-medical volunteering, right? So medical volunteering can be anything in the form of what you do in your rural health and SPM, right? SVB programs, school health awareness, nutrition surveys, stuff like that. So medical volunteering, you do a lot of camps in med school, so that takes care of medical volunteering. But non-medical volunteering, I think, is something that kind of get lost in translation. I think you should probably kind of go in and check unique opportunities to work on different platforms. So you can probably work in different foundations that are non-medical related, probably UN, UNICEF, WHO, Red Cross. Red Cross probably a little more medical, but kind of check out all these organizations that are giving you non-medical opportunities. Like, I remember an assistant program director at Cleveland Clinic once told me, focus on things that people don't do routinely. So if you're saying I'm teaching underprivileged children, that's very cliched. A lot of people end up doing that. So focus more on, I don't know, probably helping with shelter homes, or I don't know, helping with food for homeless people. Something that is out of the box, which is not very cliched. So that is something to think about when you're volunteering, right? And then research. So research is something, unfortunately, that none of us are very well versed with. And I'd say one thing with this: the key is to find good, experienced mentors when you're in med school and when you're at your electives. That's all. Leave it as simple as that. When you find these rotations, you have really experienced people you're working with. The key is to ask these people if they have any research projects going on and kind of volunteer to help. And the same thing in med school, right? So when you have so many opportunities in med school with faculties, kind of collaborate with them, offer to help, and try to publish as much as possible in med school. And that's it pretty much with research. But the key with research is it's one of the most important requirements if you need to get into an academic program, like a top academic program. If you're targeting the top 15, 20 academic programs, having good quality research is very important. And I feel the only way to do that, I mean, you will find multiple platforms promoting a few shoddy journals. Like, you'll probably be able to pay a little and kind of get your name published in a few, or collaborate through WhatsApp and publish a few systematic reviews. But I feel the key is to kind of really find experienced mentors and spend time with them and work on good quality projects.
Okay. So you think more than just getting a whole bunch of research, it's more important to get some fewer like quality projects opposed to that?
100%, my dude.
Okay.
100%. 5 good quality first author publications in really good impactful journals, more than enough to crack any kind of research. So one of my mentors at Stanford told me, when you evaluate research, you look at it in 3 ways, right? You look at it in forms of oral abstracts. How many oral presentations do you have at international conferences? How many posters have you presented at international conferences? And how many publications do you have? If you're going purely on research, these are the 3 criteria they evaluate you by.
Okay.
So the more time you spend with them, the more quality you publish, the better you kind of work with. But I would say don't get into the trap of trying to pay money and getting research published quickly just for the sake of boosting the volume of your publications that has no yield whatsoever. So don't do that. Don't do that is what I'd say.
That's awesome. I mean, I think a lot of us had that misconception there, so you cleared that up for us. Now, a next thing, like when you talked about getting rotations, and then obviously a lot of the viewers are from India and don't have visas and passports and all that. So could you just kind of give us a brief idea on the visa process, what visa they need to go there?
Sure. So the visa you require for these electives is a B1, B2 visa, right? So it's business/tourism. One of the main things I think about while applying for this visa is definitely factor in the wait time. So when I applied, the wait time was for more than a year. So I'd say one of the first things you should probably do when you start off the USMLE journey, if you don't have a visa, is apply for a visa right away, right? Because these things can take time. You can't expedite things as per your wish. It's a very clogged system. So definitely look for slots, book an appointment, and if you're a medical student, I would always suggest to use the purpose of a visit as a medical elective only. Never say I'm going to a cousin's graduation ceremony, or I'm attending my brother's graduation, or I'm going to visit my relatives. Because at this age, as a medical student, it's extremely suspicious. So you probably have to present a valid elective letter stating your reason clearly, mentioning how long you're going to be doing the elective for, and then you get your B1, B2 visa, which allows you to stay in the US for 6 months continuously. and you have multiple entries for 10 years.
Okay.
That is the visa you use for rotations. It's a
Okay.
B1, B2 visa.
So do we have to have the electives in order to apply for the visa, or like how does that work? Or it
Yeah.
just helps us?
Yeah, I mean, it's not a hard and fast rule, but I'd say it's preferable that you have an invite letter from an elective institution. That kind of almost solidifies the chances of getting a visa if you're a student. But the problem is, you could always use other reasons of visiting, like having a cousin or having a
Of
sister
course.
or something. But as long as you don't have like a planned purpose of visit, your chances of rejection get higher. So
Yeah.
I definitely recommend having an elective invitation letter before
Okay. Yeah.
applying. Yeah.
That's awesome. So that kind of covers mostly on the general things. Now I want to go a bit personally.
Right.
For you throughout your USMLE journey,
Right.
if you could go back, let's say the first year of medical school,
Right.
what would you do differently, would you say?
Right, that's a really hard question, and I actually have a lot of thoughts about this as to what I could have done differently. I'm very content with what I've done so far, but a few tips for people who are starting off. I'd say start studying for step 1 really early. So that is one of the mistakes you tend to make as a med student, because I get it's really hard to cope with the curriculum in India, right? You have 4 years of exams, lot of rigorous training, lot of postings you gotta attend, stuff like that, along with extracurriculars. But I'd say if you're really serious about USMLE, really try to give step 1 before you enter internship, is what I'd say. Get step 1 done with. By that I mean, get it out of the way and get your concepts consolidated. Because what happens is, once you get post internship, your basic concepts have evaporated by then.
Yeah.
Because you're 5 years out of medicine, right? So all the physiology, all the anatomy seems like Greek and Latin at that point of time. That's a lot of stress when you
Yeah.
have 2 exams after graduating, right? So I'd say solidify step 1, do it really well, do it when your basic sciences are fresh. I know it's really hard to integrate that into an Indian teaching curriculum, but trust me, getting step 1 out of the way before you get into internship is massive.
Okay.
It really changes your game. Like you have a lot of opportunities with step 1. Like we were talking about the electives we got to apply to, right? A lot of those places require step 1 as a requirement.
Yeah.
So once you're done with step 1 before internship, you could always use that step 1 score to apply for these electives.
Of course, yeah, yeah.
So that is one regret. And also, I'd say research and volunteering, right? Because the access to faculty mentors is like massive in med school. You go through so many subjects, you meet so many people. The chance to collaborate and work with people, even if the collaboration is not very high level, as long as you're getting insight into how research works, what am I publishing, what are my interest areas like, you get an understanding as to how this works, so that when you go into the area of the journey where you're really sure about what you want to work on in research, you have a basic understanding of what research looks like. So you're not starting from ground zero, you're starting from a certain level, right? So I'd say research, people underestimate that a lot. And I like to emphasize, a lot of people would probably tell you get steps done with first initially, and then start doing everything other than that, like research, volunteering, electives. It doesn't work like that.
Okay.
You got to think of this as a marathon, right? So you got to factor in all the aspects when you're applying. So research is as important as step 1, that is as important as step 2, which is as important as electives. So really make sure you kind of focus on the holistic review of your CV. So research and volunteering, definitely try to find as many opportunities as you can in med school. I think that would probably, yeah.
Okay.
Probably.
And then, I mean, you kind of mentioned a bit of the proper time to take step 1. Step 2, do you think that we have to do it before internship, or is there no like time? What would you suggest for the time frame of step 2?
I think the best way to do it is give it during your internship.
Okay.
Take like a 3-4 month break during your internship and get done with it. So what that does is, assuming we're following the ideal timeline, right? So you're done with step 1 before you enter your internship, you're done with step 2 when you're in your internship, and now you have an understanding of research because you work with your mentors.
Yeah.
And you've volunteered in school. So all of this gives you a decent platform to apply to really good electives, and that can help you stand out. If you don't have a lot of alumni, coming from a small college, you don't have a lot of alumni, right? So it's really important that you have something on your CV that makes you stand out. And then once you get into those electives, you get good letters of recommendation and a possible postdoc opportunity where you can work with them for a year at research, and then you can probably like really target one of the like top 15, top 20
Yeah.
places if you want to get into a good place. So that is probably something I would suggest. Get step 2 done during your internship is probably something I suggest. Yeah.
That's awesome. Yeah. So you're going into IM, internal medicine.
Right.
So what kind of helped you decide that, or what experiences kind of led you to that? Because that's a really tough decision that I personally am struggling with also right now.
I loved retrospectively challenging my brain, right? So when I see something, I really love tracking back on it, exploring what the other differentials could be. For me, it always felt like solving a puzzle. I know it's cliche, but it always felt like solving a puzzle where I'm exploring different diagnoses and I'm using algorithms to see whether this is working or no. And if it's not, I try another treatment modality and see if that works. And the best part of medicine is if you're very academically inquisitive, it's the most satisfying thing ever.
Yeah.
You get to learn so much pathophysiology, you get to learn so much from your team as a whole, right? Because so many people have so much different skill sets that they're bringing to the team in terms of knowledge. I think it can be a really fulfilling environment if you really love medicine. I really loved, so if I'm being honest, I really loved physiology and pathology as a second year student, right? I really knew that I wanted to do medicine from my second year because there was something satisfying about understanding those intricate physiological processes and what was going wrong with them. I was very fascinated by that. So second year kind of built a foundation for me, and when I went into fourth year and started reading medicine, I was like, this is what I want to do. And then when I got into housey and went into the wards, I was like, I'm sure this is what I'm doing. So I see it's different for everyone. I wouldn't say each person thinks in the same way. Everyone has like a different reason as to why they get into a specific branch, right? But for me, it was this academic inquisitiveness that kind of led me towards medicine. Yeah.
That's awesome. Yeah. So just kind of before we close up, what is some of the best advice you would have for us? You did mention it throughout the video, but just kind of summarizing those points for up and coming USMLE aspirants like myself.
Right. So I'd like to summarize and keep it brief because I tend to like diverge from the point, but I'll try to keep it brief. Okay. So let's discuss whatever we did. Right. So basically 2 steps. It's really important you score well in your step 2, and there are like 1,000 resources and videos on YouTube for that. But really make sure you score well on your step 2. For that, the most important thing is having a good base on step 1, right? Apart from that, 3 areas: research, volunteering and electives. Basic research and volunteering in med school with a good step score, I feel, is the best way to apply for electives. And really be cognizant of when the elective portals are opening so that you can apply as soon as possible with good letters of rec from college and a good CV, and really increase your chances of matching into those electives. And then the whole thing comes together for the match, and hopefully possibly once I match, I could probably give you a more detailed analysis as to how the match works and how the interview season works, and probably things might change in retrospect once I go through the season. I could probably provide you with some new insights then, but for now this is all I had on my brain, and I try to contribute as much as I could.
I loved it. I'm so thankful for you being here. Guys, I hope you understand how great of an opportunity this is. He's going to enter the match 2025. Wish him luck in the comments. Personally, I wish you great luck with that.
Thanks.
That kind of wraps up today's video. I hope you all appreciate it. Stay tuned. We have another amazing video from a super qualified applicant as well coming up. And hopefully after both of the applicants match, we can have follow-up videos where they can give a bit more insight on that process and what really helped them throughout that journey.
Thanks, man. It's a pleasure.
It's a pleasure. Appreciate you for coming. Stay tuned. I'll catch you guys next video.